participants.
Okay, okay.
And
So
each
27.
participants will present 5 to 6 minutes in
Yeah,
video.
yeah.
And then
Yes,
the
yes.
question and answer is 2 minutes.
Yeah.
So me and you already calculated if one participant is 5-minute presentation,
Okay.
Q&A 2 minutes. So
Okay.
one participant is 7 minutes. So one
Okay.
session will end around 1 hour 3 minutes.
Yeah, yeah. I can understand that. Maybe the
Mm.
day one we kept in the last session only the oral the e-video presentation, so that
Yeah,
maybe we can extend
that's right.
5-10 minutes. I think it'll be okay. So you can put in that slot actually the day one last session.
But is it okay if
That is okay.
we
Okay. Okay.
finish
Can
late?
can can sign the e-video presentation. I think if we extend little bit extra time, especially last session, right? There is no after that. There is no session. So I think
Yeah,
we'll be okay that day.
because I'm afraid with the participant from other country because the time is not same like us, right?
Yeah, yeah. But my suggestion is if we put that day one session for the foreign participants, I think will be okay. If extended after 6 o'clock, still okay. Because for them, the time, for example, in India, the time is around 3-4 o'clock only, 3:30 only. If here it is 6 o'clock means. So I think for them will be still working time only.
Okay.
So maybe you can include it in the day one session because day two we may be in rush to complete the program. So we cannot extend the time for long period of time. Day one I think will be okay. Last session only, right?
Yeah.
You can extend and maybe only the presenters. Mostly they will be present during that time. Most of the participants, those are having some work. I think maybe after 5:30 they can leave the meeting, something like that. I think no issue. The judges are available, participants are available, and that will be fine, no problem.
Okay. My question is another question is regarding the e-poster. Previously, Faizan already tried in e-poster breakout room 1.
Okay, okay,
So that one we use slide presentation,
okay,
but it's quite lax. And
okay,
then I think me and Dr. Faizan try to compile
okay,
20 videos, make it
okay,
into a video, and
okay,
then try to play
okay,
for the next trial. And
okay,
we
okay,
will also prepare for the slide presentation to see which one is better.
okay, okay, okay. That is fine. So that we are going to put in the breakout rooms, right? All the posters.
Yes.
One more issue. Let's say if you want to compile 20 posters in one short video lah, and then we make it into 5 breakout rooms, example. But we need 5 people to at least 5 laptop lah to control because one will be controlled in the breakout group 1, another laptop in breakout group 2, breakout group 3. So we need like 5 or 6 laptop to shoot to project the slideshow.
Okay, okay. Means every time we need to do something over there, or just that will run continuously?
It can be set like I think run continuously.
Okay, okay. But we need to monitor.
6 laptop to be concurrently on.
Oh, like that.
So each laptop is projecting one show, another one, because they have 6 breakout rooms.
Okay.
I think
Mr. Hadi, what we can do in the IT room, is it possible to make it this one?
I don't think we don't have that
yes,
enough laptop.
I think at this moment, sharing via Google Drive, I think is the best option lah.
Yes, I agree.
Yes, agree.
Okay, we go for that one only. No problem.
Or other, we just want to see, we compile everything in one breakout room and then we can play whole. Right?
Yeah, something like that we make it. We put as per our previous plan, put all the posters in only one breakout rooms.
Yes.
Okay. The rest maybe alternatively we can give the link also to the participants to view the posters.
Yes, if they want to see specifically of the posters, they can click on whatever they want.
Yeah, something like that. That is better. Yeah.
Okay, and my question is, if we are going to post it in breakout room, so do we will play the poster throughout the day of the conference, or only at specific time?
No, morning 8 until 5 o'clock or 6 o'clock. Not specific time.
So 8 hours playing the poster.
Yeah, something like that. But in between, if anything, maybe we can put something la in the break time. Maybe we can change it something.
I think Faizan's suggestion is the best at the moment. We compile all the posters into one, just put it into one slideshow, and it's in the breakout room, just one laptop to control it and let it run continuously.
Yes.
Then we provide the Google password protected link.
Okay.
And restrict all the download, editing, and everything.
Can.
We have to test from our side here. Make sure that we really cannot download first lah.
Yeah.
Then we pass to the participant and let them know that you can actually check the details of each poster there. The poster will be there for 2 days. That's it. The link will expire after 2 days.
The Theo here. Can we try and play one participant's video?
Can.
I think sudah bagi NJ Hadi.
Yeah.
Oh, okay.
NJ Hadi will play. Yeah.
Okay.
So I think Faizan, nanti kita bincang boleh?
Okay, Dr. Judy.
Google link tu you nak buat sendiri atau nak dapat dari siapa?
I tak pandai guna Google link, Dr. Judy.
Saya pun tak tahu, kena minta.
Tapi I dah bagi link for all posters to Encik Hadi lah semalam.
Encik Hadi boleh tolong arrange?
Okay, boleh.
Sorry, Hadi, saya tak tahu.
I think okay, we can make it. So Dr. Yazir and Dr. Faizan, so we received all the posters, right?
Not
yet,
all, around 117.
Okay, that will be fine.
There's
okay, we can give.
Yeah,
we can give 1 or 2 days extra also. I think will be no issue.
Okay.
Yeah.
And what about the e-video?
E-video, we not receive one video only.
One only. But did you contact the participant? Whether?
Yeah, I'm trying to contact now.
Okay then. So you can include that one more person also from what Ms. Rara is mentioned, the e-video.
Prof, we are trying to find his name.
Okay, fine. Okay, no problem.
Yeah, no problem then. I think we think maybe we proceed with the looking at the videos first, see how they actually display out. Is it okay, Encik Hadi?
Yeah. Okay, yeah.
So Dr. Yazir.
Yes, Prof.
The day one last session e-video presentation, you can include all the overseas participants at the end, so that for them timing there is no issue, because for them time will be 3:30, 4 o'clock only, so for them no issue. So you give preference to the Malaysians in front, actually means 5 to 5:30, something like that. After that you can give a slot to the overseas participants in the day one.
All right.
Okay. If possible, day one even you can extend the number of presenters to 12 or 13, still will be okay. You reduce the numbers in day 2.
Okay. Prof, I want to ask when the registration committee will send the link and everything, because I think I would like to ask them to give the timetable for the presentation session as well.
Maybe today is Tuesday, right? I think 2 days, 3 days before only normally they send, because if you send it 5, 6 days before also, sometimes they may miss out. So Friday, is it okay, Mr. Hadi, the final link? Because the registration committee, they already created a group for all the email IDs. So just one email with all participants, it go directly, so no problem. Mr. Hadi from IT, whether the link, or we can make a link ready 2 to 3 days before also will be okay, right?
Yeah, can.
Okay. So Friday is the deadline we can keep, Dr. Yazir.
All right.
So Friday morning we can send the link to all the participants along with the details of that presentation also. Or maybe one my suggestion is, because e-video presenters only 27, including that new one, so 28, right? Hello.
Yes.
That 28 participants, maybe you can send separately about the timing earlier, so that they come to know when their presentation, because 28 persons only, right?
Okay.
That is better. Because they need some kind of preparation for their presentation. So according to the timing or when their presentation, they will prepare accordingly.
Yeah. And then I also have to explain to them that we are going to play the video. And then after the video, there will be question and answer with the judges, right?
Okay, immediately after their presentation or after this, the whole session?
Immediately after each
that is better.
video.
That is better. So that once they completed, they will be free so that they can.
And me and you already assigned 2 judge for 1 video. So the video we will pass to the judge earlier so that the judge can listen to the video earlier. So they can actually come out with the question already.
Okay. Means they evaluate everything excluding the Q&A session in the rubric.
Yes.
So Q&A question. So based on the participant answer, they will mark. That's only that part only. Okay.
Yes, correct.
Okay, Dr. Mahendran.
Yes, Dr. Patro.
So just to confirm, so e-videos will be telecasted in the main channel. There will be
main
no
channel.
breakout room.
Main channel.
Okay. So then we should be, because I suspect that 2 minutes may not be enough for question answer. So we think like that. So definitely, even a couple of questions, the judge will put couple of questions and they will, while they respond, if there is a cross question, then definitely that extends.
It may extend 1 or 2 minutes. So that is why.
So then if it goes for all the participants, then I think if it goes beyond like 20-30 minutes extra, then will the main schedule will be disturbed too much?
No, that is why I asked Dr. Yazir to put maximum presentation the day 1. So day 1 we put in the last session only e-video presentation. So after that there is no session.
Okay, so on that day it is okay, but the next
day, day 2 we need to. Yes. Day 2 we need to keep minimize the number of presenters so that we can maintain the timing. Because after that we have the scientific session also, other session also.
Okay.
I think we'll be okay. Maybe the judges need to come up with 1 or 2 questions only, not too many, so that they can. Is that okay, Dr. Yazir? You can inform the judges to complete the Q&A within 2 to 3 minutes with the word.
Yes, can.
You can ask them to come up with 1 or 2 questions based on their e-video.
Yes.
That is better.
Yes, basically 1 judge, 1 question.
Something like that is fine. Maybe I think will be okay.
Okay.
This is our first time also conducting this virtual conference. Maybe next time we can plan something different. Because now last minute, if we change something, then everyone will be under trouble. So.
So we should be prepared.
Something like that. We will try to maintain our timing. But day 1 session, we can extend up to another 30 minutes, 20 minutes extra. I think will be okay.
Okay. Sorry, I have not gone through the program schedule correctly. So second day, when is the first session for the
morning? I think we have morning 1 and afternoon 1. There are 2 sessions for the e-video presentation.
If the session is just before lunch, then I think during that session also there is a scope of extending
time. Those are want to go for lunch, they can go for lunch. Those want to listen, they can listen.
So that again the next session we can start in the correct time.
I think something like that only we made it before the break time only, or maybe before the lunch time, something like that only we made it, so that we can extend 10 minutes.
Okay.
Prof, can we actually ask Encik Hadi to play the video? I think it's very important.
Hadi.
I think we want to see all the clarities and things. If there's a problem, then we need to actually find alternative like how we do for the poster.
Can.
Okay. Encik Hadi boleh tak? Tolong. Thank you.
Assalamualaikum and good day. I'm Nur Amalina binti Zainul, pharmacist from Hospital Tunku Fauzia, who will be presenting a study entitled Retrospective Analysis of Respiratory Medication Therapy Adherence Clinic (RMTech) in the Management of Pediatric Bronchial Asthma. And here are the list of common abbreviations that will be used throughout this presentation. In most healthcare settings, pharmacists and physicians often do not readily communicate because they work independently and in parallel rather than collaboratively. Hence, Pediatric Respiratory Medication Therapy Adherence Clinic (PRMTech) serve as an excellent platform for patient-centered care. In Malaysia, not all hospitals provide PRM Tech service. Hence, this study focused on the roles of PRM Tech to complement clinical pediatrics management of bronchial asthma on the provision of clinical assessment, counseling, and monitoring. Moving on to the methodology, the study design of this study was a cross-sectional retrospective cohort analysis. The samples obtained were from 1st January 2019 until 31st December 2020. The sampling method used for PRM Tech records and medical pediatric records were purposive sampling and convenience sampling respectively. The targeted population in this study included pediatric bronchial asthma patients in Hospital Tuanku Fauzia. Next is the results obtained from this study. There was a total of 87 medical records retrieved for the study, 47 patient records with ongoing PRM Tech service, while another 40 records were of medical outpatient pediatric bronchial asthma without PRM Tech service. This table describes the distribution of assessment of adherence and MDI technique during routine follow-up visits. There was a significant difference in the conduct of assessment for MDI technique between patients who underwent PRM Tech and patients who didn't. From the table, it was evident that those who underwent PRM Tech had been regularly assessed for MDI technique as compared to those who only had outpatient follow-up with medical pediatric teams. There was no significant difference with regards to assessment of prophylactic adherence. The study also performed logistic regression to determine significant factors associated with good asthma control by the last clinic visit of the year. The results indicate that an increase in age by every 1 year had 1.2 times higher odds for good asthma control. The results showed that good inhaler technique and PRM Tech status were predictive of good asthma control at the final clinic visit. Patients with correct inhaler technique were 6 times more likely to attain good asthma control as compared to patients with poor technique. Multivariate analysis demonstrated that good inhaler technique is the only factor significantly associated with good asthma control after adjusting for age, adherence, and the presence of PRM Tech service. Detailed assessment throughout a year-long follow-up visits between patients undergoing PRM Tech versus no PRM Tech were performed. The study determined that the comparative score for the assessment of interval symptoms and counseling was significantly lower for patients who were not subjected to PRM Tech service. PRM Tech service is a significant aid to the outpatient management of pediatric bronchial asthma. Specific criteria need to be fulfilled when assessing patients with bronchial asthma. The study found that these clinical assessments were inadequately assessed by the medical pediatric team during routine outpatient appointments as compared to the more inclusive assessment carried out by PRM Tech service. Next, lack of proper assessment of adherence and inhaler technique, particularly among non-PRM Tech patients, may result in poor technique and inadequate therapeutic relief. A study by Tanimalai in 2018 found that the odds of good asthma control was 3 times more likely with pharmacist intervention than without. Therefore, this highlights the important role played by PRM Tech service in the monitoring, counseling, and assessment of pediatric bronchial asthma. In addition, good inhaler technique, older age, and PRM Tech status were predictive of good asthma control at the final clinic visit. Patients with correct inhaler technique were 6 times more likely to attain good asthma control as compared to patients with poor technique. The result was well supported by a study done by Kapanoglu in 2015 that assessed the effect of correct inhaler use and adherence on asthma control was better among correct users. Moreover, good inhaler technique is the only factor significantly associated with good asthma control after adjusting for age, adherence, and the presence of PRM Tech service. This finding was supported by a study among 330 Egyptian asthmatic children aged 2 to 12 years old that found better asthma control to be significantly observed among patients with correct inhalation technique. To conclude, PRM Tech service is essential in the outpatient management of pediatric bronchial asthma, particularly among those with partially controlled and poorly controlled illness. We strongly advocate that healthcare providers to move beyond task-based work towards a more collaborative approach and support interprofessional shared decision-making to improve patient care. Here are the list of references for this presentation. Thank you.
Very good. Very clear.
Okay, how about second second video?
Can we have someone to act as a chairperson to start introducing the thing, and then we jalan?
Okay.
Can Yase, can you try to be the chairperson?
Okay, I try. Now I would
You
like
just okay.
now I would like to invite blah 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 to how to say. Now we would like to play the next video from blah 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 blah. Okay.
Okay. Then okay. Oh, this is very clear.
Okay, wait. Okay.
This is a study on preventive measures towards COVID-19 among the public in Malaysia. So COVID-19 is a global pandemic caused by the coronavirus, and it was first detected in Wuhan, China in late 2019. It causes flu-like illness, and in major cases can cause respiratory illness. Around the world, it has caused more than 180 million cases, as well as more than 4 million deaths. So in Malaysia, the cases have been rising since last year. Preventive measures have become the mainstay of COVID-19 management, which includes wearing a face mask, physical distancing, and hand hygiene. Very recently this year, vaccines have also become available. But because there's been a continuous increase in the number of cases on a daily basis, we want to see how well the public actually adheres to these preventative measures. This is the aim of my study, to identify COVID-19 preventive measures practiced among the public, looking to mask wearing, physical distancing, hand hygiene, and vaccine hesitancy. This was a questionnaire-based study which was distributed online via Facebook, WhatsApp, as well as email. Results and discussion. The socio-demographic characteristics of the respondents showed that majority were female and most were Malay, which was in line with the Malaysian population. As you can see, 89.3% of respondents said that they always wore a mask when they were out and about. There were some complaints when wearing a mask, such as difficulty breathing, facial skin irritation, acne and headache, and these could be among reasons for possible non-compliance. There was an association between demographics and mask wearing. Previous work has shown slightly different results. In this particular work, younger male respondents were less likely to wear a mask than older respondents. We also asked about cloth masks that were often used, but we found that very few understood the strict requirements of using an effective non-medical grade mask. So in terms of physical distancing, the public in Malaysia showed that 43% did not comply to physical distancing, but this was a lot better than what was found in other work, which showed a higher percentage of 92% and 46% that did not adhere to physical distancing requirements. Next, we looked at hand hygiene, and we found that about 47.9% said they always comply to hand hygiene, and this was similar to what was reported in previous work. Vaccine hesitancy was very important for us to look into. 67% of the study population said that yes, they wanted to take the vaccine, and it was shown that with a higher public confidence score, they were more likely to agree to vaccination. In terms of vaccine hesitancy, those that accepted the COVID-19 vaccines had a lower hesitancy level compared to those that did not accept the COVID-19 vaccine. And those that had a history of H1N1 vaccinations were more likely to accept the COVID-19 vaccines as well. So this was something that was similar to previously reported. In conclusion, although we performed the study a year into the pandemic, there was poor management of preventive measures. It is quite possible that the public has SOP fatigue, so the healthcare professionals may need to highlight strategies that include compassionate attitudes, as well as continuous education and assessment. We also need to look into vaccine safety to promote vaccine effectiveness and ensure herd immunity is reached as soon as possible. Therefore, until we reach herd immunity, preventive measures such as mask wearing, hand hygiene, physical distancing must still remain in place. So with that, I thank you. And these are my references.
I think this also okay.
Yeah.
The voice is clear and the picture and everything is clear, only the clarity, resolution, everything.
Yeah, this is very clear. I think it's from the participant now, that's why it's so clear. So
okay. Okay. Dr. Faizan, can you show the e-poster, how it looks like? Can we see that?
Dr. Mahendra, you mean one by one, is it?
Just we will see at least 1 or 2 posters, how it looks like in the screen.
Okay, I try.
So shall it be displayed here only? Hello.
Yes.
Dr. Mahendran, you want Dr. Faizan to display in the main channel or?
Yeah, in the main channel only. Just to check only. Later on we can put in the.
Or he can display in a breakout room and all we can go into breakout room and can see.
No. Now let him display here only, because everyone then need to go, because some still it is not allowing to go into the breakout rooms. Those are using MacBook. So later on maybe we can try in the breakout rooms. Now just let him share in the main room only.
Okay then.
Okay then.
Can you see?
No, I think Mr. Hadi need to this one.
Okay.
Still we are seeing that the slides only, the previous presentation. I think he need to stop sharing. I think then only he can.
And see Faizan's screen. At the top there is view app option, so you can go to.
Yeah, now okay. Can. I think will be okay. We can see clearly the poster also. If you go to full screen view, I think it is still very clear.
Yes, agree with Dr. Mahendran. Very good, actually.
So can't we like instead of one main page, can't we make in the main screen like 4 subparts, and if somebody clicks the first one, they will go to main channel, and someone clicks to the other one, they will go to breakout rooms. Is it possible that we can make like this?
Means those are interested to go to breakout rooms, they can directly click breakout rooms, right? So
Yeah. No, what I'm saying is that in the main page only, like it will be divided into 4 quadrants. First quadrant takes them to the main page, link, and the other quadrants, if they click, they will go to the breakout rooms.
Okay. Now anyway, we are going to make only one breakout room only, Dr. Patra. So not many.
Oh, okay.
Only one displaying all the posters, because we plan to give a link also to the participants to see the posters.
Now they were saying that we will be creating so many breakout rooms, like for 10 or 20 posters, one room.
Yeah. That is why now Dr. Faizan said that some problem that we are facing when we make it into many breakout rooms. So we need to keep many laptops and we need to run simultaneously. So So finally, we come up with only one breakout room to display e-posters, all the e-posters together. At the same time, we will give the link also to the participants so that they can view anytime. There is no problem.
Dr. Mehra, can you see the antioxidant and free radicals scavenging activity?
Okay, but I don't think this is in our format, but still okay.
The font is quite
but
small.
The font
actually.
is very small. I cannot do anything about it because original posters coming like that.
Oh,
Faizan, I think it's okay now because we give them the Google link. If they can't see, they can go and view it.
Zoom and see.
Yes, correct.
Yeah.
I can see on my 23rd inches screen, but I'm not sure whether they can see on their mobile phone.
Those using mobile phone, can you see?
They just skip.
I can't see phone.
Mine is also very small.
This is the poster size that we provided to them. The previous one I think was okay, but this one I'm not sure.
The previous one okay, but then I think some of it is not following lah.
It's okay. We cannot ask them to change it. Just to display whatever they prepare.
Yeah, correct. But for judging punya purposes, actually judge can zoom out, and I think.
Yeah, that will be fine. No problem. So Dr. Faizan, you agreed with that one, right? We will put only one breakout room.
Yes.
Displaying all the e-posters like a slideshow throughout the day. And also we create a link and provide to the participants, right?
Yes, that one better.
But that through that link, they should not download or they cannot copy something like that.
Yes.
Okay then.
Okay.
Thank you. Anything? I think.
Jadi, do you want to try playing the video again just now this morning? That I think is the video which has the sound and no images.
Okay.
Yeah.
All right.
This morning there's some problem, right?
Okay,
Yeah. Let's have a look again.
Okay. Try to run on third video, maybe third and fourth video. Okay. Test now.
Assalamualaikum and a very good day. I'm Noraida from Faculty of Pharmacy at UKM, and today I would like to share with all of you research titled Caregiver Self-Efficacy, Diabetes Management and Glycemic Control Among Children with Type 1 Diabetes. As an introduction, self-efficacy had been studied in adolescents and adults with type 1 diabetes, and results showed that higher self-efficacy had been linked with better adherence to treatment and better health outcomes. Adherence to diabetes management.
Okay, wait. Okay, I'll try to play the introduction video.
It's breaking, the video.
Voice
sound.
breaking. So what we can do, we can allow to present same thing, or maybe you want to request the participant to send another video. I'm not sure what to do. Oh, this also
lagging, but play on laptop, not like that.
I think this is because of my PC, if I'm not wrong.
Yeah, maybe because this is
I think Ghazali made this a high quality video compared to the presentation video, which is a normal quality. So that's why.
Okay.
I need to try with a better laptop. Okay.
Encik Hadi,
Yes.
can you try to play the EV124 or EV114?
Okay, wait. 124. 124.
Oh, that means Mr. Hadi is having already all the videos, e-videos.
Yes, yes.
Okay, then that is fine.
Okay, 114 first.
Hi, all, I am He from University of Cyberjaya. My research title is Development and Evaluation of Core Process Excipient for Endotyping Orally Disintegration Tablet
I think
Application.
we can hear, right?
This is my presentation.
This one is very clear.
Core process excipient are prepared by combining one excipient into particle structure of another excipient to obtain better features and tableting characteristics than a single substance or physical mixture. Advantages of core processing are to get fast disintegration, improves compressibility, improve probabilities, and ease of production.
Can you try 124?
From the
124.
review, angle of
Okay,
repose,
wait.
hardness ratio.
Okay, I search for 124. Did you share together in the OneDrive folder, the 30th? Previously?
Yes, I share in the OneDrive.
OneDrive, okay, wait. Okay, the folder you shared on last Sunday, I think I don't have the 124. 119 and then straight 126, 127. That's all. Maybe you can check again, the 30th.
I shared yesterday.
Oh, yesterday. Okay, wait.
Just on my laptop, it's quite soft.
Dr. Judy? Dr. Judy?
Yes.
Yeah, this one regarding the biography of chairpersons. You just get it from the chairperson and pass it to MC so that they will also do some kind of preparation to introduce a chairperson during the scientific session.
Okay. Yes.
Later, if you pass till Thursday, Wednesday or Thursday, I think will be okay. But you just inform the chairperson to prepare the biography, very short biography.
I think about 2 sentences is enough because
I think will be 3-4 lines. I think will be fine.
Yeah. Okay. I'll ask. I'll get the.
Yeah.
I have the chairpersons already, so I'll get the biodata from them.
Okay.
Okay. Thanks.
So, Dr. Judy, have you already allotted the chairpersons to different scientific sessions?
Not me. That one I've already passed to Dr. Teo and Dr. Yasir and Dr. Faizan. So I'll actually get the update from them later.
Okay. Thank you.
Hello, are we waiting for the video?
Okay, I think the video maybe you can play from your side. I have problem to download it from my side.
Okay.
Sorry.
How do I go?
Okay, make sure you.
Yeah, Mr. Hadi, one more thing.
Share the sound also.
Hadi.
Yes.
Yeah, regarding the when we have the conference day, so we can mute all the mic, right? Participants' mic. We have the control, right? We can mute all the participants' mic. Okay.
Yes, can.
So only we can allow them for the presenters or maybe the VIPs, like that.
Yes, can.
Okay.
Hello, I am Jordan Dion J. Kundahal from Faculty of Pharmacy, UiTM Chawan Pulau Pinang Campus Pertama. On behalf of our team, I would like to share our study titled Impact of the Comorbidities and Medication Research on Psychosocial Wellbeing and Quality of Life Among the Elderly with Type 2 Diabetes mellitus preliminary findings. In my subsequent presentation, I will use the abbreviation T2DM to represent type 2 diabetes. First, I would like to give a brief background to our project. So we all know that T2DM affects more than 25% of the global population aged more than 65-year-old.
He speed up his video, is it?
Cardiovascular diseases, and therefore
I think got two presenter talk quite
that
fast.
quite a substantial of patients, where 65.6% of patients had experienced psychological problems. And another study found that T2DM patients aged more than 50-year-old have poor quality of life. Medication adherence is therefore pivotal for good glycemic control among patients with T2DM. Nevertheless, the impact of multiple medication usage in elderly with T2DM
is the video okay?
Yeah, I think video okay, but little bit fast, but we cannot ask.
Video is
I think
okay.
This is okay.
The speed is like someone press 2 times speed or 3 times speed, something like that.
Or like that.
No lah, I mean the way they are talking.
Yes.
Longitudinal aging study in Malaysia, which known as the AGE study. The questionnaire included the socio-demographic characteristic, the drug regimen, and validated questionnaire winners.
So Prof. Mahendran, we have to accept, right?
Yes, we can accept this one because we cannot ask them to change it now.
Okay.
So whatever they given to us, we just telecasting that.
Is it clear? The audio?
ICPHS version 26.
Audio is okay, little bit fast, I think. Apart from that, I think okay. And based on the slide content, I think the judges can evaluate also.
All right.
Okay. Then I'll share the chairperson for the section. So we have 3 sections. We will have e-video 101 until 109. But I heard from Dr. Yazir, I think we need to make some changes lah.
Yeah, and with the tentative program also we have revised recently because Prof. He asked us to extend the time for Teresa Lamb presentation. So 30 minutes, I think, extended in the current one. So maybe accordingly you can prepare. I shared already to Dr. Yazir and yesterday, I think, regarding the revised tentative program.
Okay.
Thank you.
And I think one more thing I need to share is the these are the compilation of the video length. So we have 4 video as it 5 minutes. So we should ask them to shorten the video, right?
Yeah, that is better. You just ask them to make it 5 minutes and send to us.
two of the video are from the India presenter.
Oh, okay. 9 minutes, huh?
Yeah.
Okay. Maybe you can ask them to reduce it. Otherwise, we need to put in the last. That is why I told them to put this and all in the last session of day 1. But the 9 minutes is a little bit high only, so we can ask them to reduce it.
Ask them to reduce to 6 minutes. So I think 6 minutes we can still accept. 10 minutes is like two videos already. So ask them to reduce.
Can. So we can ask them to reduce to 5 minutes, 5 to 6 minutes only. Okay. So those 4 presenters. Apart from that, the rest all I think okay.
Okay. This one EV118 she prepared in a PowerPoint slideshow. So I think there's some bugs. It's not automatically change slide. So there's a delay. So I already told her she will try to fix it.
Okay, then that is okay.
Then I think yesterday in the email I already shared the chairperson for the 3 section.
Dr. Teo, can I ask you something?
Yes.
Actually, what's the role of chairperson during the video presentation? That means we give a background information and or what? How? I mean, because this is a video presentation, what are expected of the chairperson?
I think we mostly we just play video, then ask the main judge to question.
That means the playing of video will be done by the IT people, right?
Yes, Santa. The IT people will play the video. So you have to you have to liaise. But what you need to do is you need to control the floor. As in like now we're going to display the next video from who from what. This is the title, and then the IT will play it. Once the video finished, then you allow two questions. So you will read from the chat box, and then you will actually present it direct it to the presenter. But before you start the session, it's very important for the chairperson to say that, okay, welcome back to our sessions. We're going to start with the oral and things, few housekeeping things, and few rules. All the question and answer will be done through the chat box and some kind of reminder, and then say, okay, we are going to start. You say that the Q&A will be conducted after each video, and we will you will read out selected questions and then say if you have further queries, you can actually directly text the presenter, something like that.
Yeah. I think the chairperson mainly to introduce the judges as well. So you just introduce the judges and hand over the session to them so that they will conduct the Q&A.
Okay. So I like chairperson Zaki lah.
Yes.
Okay. Thank you.
And we'll play one by one. I mean, after one video, then we'll go immediately with the Q&A, then followed by the next video.
Okay.
Easier to address the question.
Can.
That is correct.
That's correct.
Sorry, but just now we have discussed that there will be no question and answer session except the judges. Participants are not allowed. Maybe Dr. Judy?
I mean, from the floor, they can ask question, right?
No, actually, if you allow the floor to ask questions, then many questions will be raised actually. So maybe because the video might be seen already by the judges, so the judges can come up with few questions. I think that is fine. No need to request the participants to ask questions.
Yes. Yeah.
Yes,
okay lah,
right.
not really lah.
That is a plan. I think we have Dr. Judy.
Dr. Judy receiving a call.
It's okay. I think the questions from the judges only, not from the audience.
Okay.
Yeah. And for the other scientific session, the participants are allowed to ask the questions through chat box. So that questions will be passed to the chairperson, and chairperson will raise the questions. They can select selected questions only, not all the questions. Even here also during the presentation, if some participants raising some questions, maybe the judges can ask that question also, this alternative. But it is not compulsory that we need to ask all the questions raised by the party. Because the problem here is actually we have very limited time because we put 12 speakers and keynote session also we extended the time, so very difficult for us to manage it. Otherwise, we would have, we can conduct in a separate breakout room, but now we cannot change our plan, so that will affect everything. So we just proceed like this only.
Yeah,
is that okay to everyone?
Dr. Mahendran, that is
yes,
actually that is my concern actually.
Yeah, I can understand.
What I'm telling is that we should be clear from the beginning that suppose if 2 minutes means only judges can ask 2 questions.
Yeah, only 2 questions.
There is no scope. Now, like if you give an option, if the chairman tells the floor that you can give your questions in the chat box. Then if we will not give a scope of discussing those questions, then there is no meaning of that.
Yeah, then judges only, we can make it clear, only the questions from the judges only for the e-video.
Yeah, if we make like this, then it will be clear actually from the beginning. Otherwise,
yes.
Definitely there will be something coming up in the middle actually.
Yes, I can understand. Maybe only for the scientific, the remaining invited speaker session, maybe we can allow the questions from the participants. But here we will allow questions only from the judges for the e-video.
Yeah. So then what should be the role of a chairman? So that in that case, the chairman should not raise this issue, raise this one during its talk.
Yeah. Chairperson just maintain the timing and also the flow and also introducing the judges.
You can ask for the from the you can ask for the HR.
I think Dr. Judy talking somewhere.
Yeah.
So the participant is not allowed to, type in the Q&A box, right?
I think e-video, I think what Dr. Patra has mentioned, if you allow them, then there might be some questions are raised by the participants, but we don't have enough time to ask all the questions also.
Yeah, no time. No time.
Better we will allow questions only from the judges.
Dr. Mahendra.
Okay. Yeah.
If that's the case, I think better we close the chat box because I'm afraid if VIP ask the question for the participants, so need to close the chat box lah.
Yeah, can. So during the e-video presentation, maybe we can close the chat box so that no questions will be raised.
I'm afraid if VIP ask, keynote ask the question, so we still need to entertain their question, right?
Yeah, I can understand.
Okay, all right, thank you.
So we can make something like that, Dr. Teo. Questions only from the judges. So during the e-video presentation, we will completely freeze the chat box so that nobody can raise any kind of things in the chat box. Is that okay, everyone? Because very limited time we have. So maybe next time when we plan, maybe we can do something differently.
So, Prof, in that case, the judges will have to ask live lah.
Yeah, live session only, question.
Live session,
Yeah.
For the judges to ask the question, not in the chat.
Yes, directly. Not in the chat box.
Okay.
So because they might be seen the video earlier and evaluated the presentation already, and they can come up with 1 or 2 questions because 2 judges means they can come up with the maximum 2 questions each, or maybe one question each. I think will be fine. So that
all right.
So that we can complete the session on time. Otherwise, it will be extended if too many questions means. Is that okay, Dr. Nurhana?
Okay. Yes. Bye. No problem.
So I'm going to share the chairperson for the section.
Yeah.
Yesterday I already emailed.
Okay then. Because now we cannot change it to the breakout room, something like that. Means it's better actually to conduct separately the e-video session. But now we cannot change it because our program schedule, everything is almost confirmed.
Okay.
Maybe next time. Yeah. Can proceed.
Yeah. So section 1 will be chaired by Dr. Sharon and Miss Aina. Section 2 will be chaired by myself and Mr. Venkat. And section 3 will be chaired by Dr. Zaki and Mr. Santa.
Okay. So there the chairperson, judges will be different, right? Okay.
Judges, I think I need to change a bit because we want to make the foreign presenter on the first section, right? So I will change accordingly.
Okay.
Any issue with the time slot for the judge?
Dr. Mahindran.
Yes, Dr. Patro.
Can you check on the day 2 for the third session? It is 2:15 to 3:15.
Yeah.
So what is before 2:15?
Before 2:15, no, lunch break only.
Or lunch break. Then can
I
we
think
start
so.
that? Can we start that at 2 o'clock so that we'll get another 15 minutes extra?
Can let me check the program schedule and maybe we can start by 2 o'clock also. I think it'll be fine.
Yeah.
I think that is okay. We can do it. But my suggestion is that day 1 maybe you can put 1 or 2 extra slot also for the presentation, maybe so that we can reduce the time in day 2.
Yeah. And also the session 2 also. So after 11:45, is there another session?
11:45, I think there is a break. I think after that, maybe 10-15 minutes. I'm not sure. Let me check.
So any question or so I unshare?
Yeah, Dr. Patro.
Yeah.
Actually, we have the tea break 10:20 to 10:45. So after the tea break only, we start with the e-video. But maybe during the tea break also, maybe we can start 10 minutes earlier. I think will be fine. But I don't know exactly because then that will be affected. So 10:45 to 11:45. After 11:45, there is a session, invited speaker session.
Oh, and the third session?
Third session will be, lunch break is 1:05 until 2:15.
Okay. So we can make that up to 2 o'clock. Then we can have 2 to 3:15 the session 3.
Can, but I think will be fine. That also.
Yeah. Because it is a e-video presentation, may not everybody may not be interested. All the participants.
Yeah, I can understand.
So whoever is interested, they can join at 2 o'clock.
Yeah.
And also maybe I don't know whether it is possible or not. If possible, can we swap the 11:45 session speaker session with the e-video poster? Like one session before lunch and one session after lunch?
No, the problem is now already we confirm the timing with invited speakers. So now again changing, I need to inform to everyone. That is the problem now actually.
Okay.
Now if we change any timing, so we need to inform to many people. So it will be affected and later they will get some kind of confusion.
Yeah. Okay. No. That's why
just let it be like this only. Whatever we have been planned, we will try to complete the session on time. So if something is running out of time, maybe we can reduce the number of questions or maybe ask 1 or 2 questions. I think will be fine. I think it is up to the chairperson to take decision on the time.
Okay.
But 10 minutes more or less, I think will be okay. No problem. We can arrange somewhere. Maybe because some invited speaker, they may complete the presentation a little bit earlier also.
Okay then.
I think Tevo, you just proceed with your plan, whatever you have been planned. I think will be okay. Hello, anything else from anyone?
Okay, I think maybe on Thursday, we can have a complete moment to moment. I think.
Yeah, something like that. We can run everything.
Yes. When IT need to play the video, okay, what is which video
Okay,
so,
okay.
Yes, something like that.
So before that, Mr. Hadi, so you need to get all the e-posters. So which format they want to display, just get it and make sure that everything is okay. Similarly, e-video presentations.
Yes, yes, yes.
And there are some, what is that? We need to see some other videos also during the break time, like advertisements and also our Unical RCMP or Unical video, something like that. You have something right already with you.
Yes, yes. Okay, I try to communicate with Ghazali which one is the best that we can show to the participant.
Yeah. Just what are the programs are offered in Unical RCMP, or maybe you can put one video for Unical, also overall Unical, something like that. And Parag, some virtual tour of Malaysia, or something is there, right? Video.
Tourism.
Yeah, tourism Malaysia, I think something like that. So I think virtually at least they can see something.
Especially during lunchtime and tea break time.
Yeah. So they can view something. So our conference will be non-stop. Something will be going on during the lunch break also. They can, if they want, they can view some kind of videos.
Okay, all right.
I think apart from that, everything okay. Only the opening ceremony part, I think mainly with the MC and the protocol committee. So they will make the things ready. So one more thing I want to ask, whether the backdrop, whether we can give to all the committee members to use it during their session, chairperson.
Yes, sure.
That is better, right?
Yes, that will be good.
Yeah.
Like all the committee members and all the judges,
judges, chairperson,
to the screen.
Yeah. Come into the screen. They can use the backdrop of our conference with this one.
Yes.
So, Dr. Tevo, you can request, or shall I request those two participants from India to reduce the timing of their e-video presentation? You already sent the message to them. Yeah, I think we'll be okay. No problem. Maybe we can send the email to them. Yeah, anyone? Anything else you want to say, or you want to give some kind of suggestion or improvement so that we can?
Yeah, I think on Thursday when we will go through one more time, then we can have some more questions.
Yeah, I think so.
Yeah.
But I think okay, we have 6 days of time. So far, whatever we have been done, I think will be okay. We have done a trial run with e-poster and e-video. Everything looks clear, and we come up with some kind of what are the problems that we are facing also.
So now we have to create one Google link.
Yeah.
That will, and also one Telegram group.
Yeah.
So
Telegram group, I'm not sure, but if possible, that also we can make it. And Mr. Hadi, one more thing. So we need to give this YouTube link also, right? When we send the main Zoom link.
Yes, correct.
So that those are not able to enter into the Zoom link, they can go directly to the YouTube.
Yes, correct.
Okay, is it for the whole 2 days or only for opening ceremony?
No, the whole 2 days, but the link will be provided only to the participants only.
Oh, okay.
I think we'll be fine. So nobody, other people cannot enter, but that is okay. YouTube, I think we cannot restrict much.
Hopefully they will not share with others.
Yeah. But that YouTube, I think okay, we can, no problem. Because in Zoom only we need to control the participants.
Yes.
YouTube still okay. If other people also, if they watch, I think no issue.
Okay, I will try to. Okay, I can see there's a on the share screen in Zoom. There's a PowerPoint as virtual background. Okay. I will try to combine the images, the poster, as a PowerPoint. So I think we will have a second trial run.
Yeah,
before this coming Thursday. So during that time, we will try to finalize as much as we can about the Google Drive, and then the poster, maybe a video, how many videos should be present at one time. So maybe I can compile
Yes.
3-4
So
videos.
Wednesday will be okay to have
I
a
think
trial
Wednesday.
run?
I think Wednesday. Yep. Tomorrow.
Yeah, tomorrow is Wednesday.
Yes. I think okay, tomorrow maybe we can meet up again in this Zoom for second trial.
Yeah, I'm okay. Whomever is free, they can join. So
No, you were telling something on Thursday.
Thursday is our meeting. So during the meeting also we will conduct in Zoom only next meeting. So that time we will have a complete trial run, something like that.
Okay.
Tomorrow just whomever is free, maybe they can join and they can observe, give suggestions so that the IT team can do better.
Okay.
All right. I think it's okay for me today.
Yeah, but so far I think everything okay, apart from certain small issues. I think that can be rectified, I think. Okay. Yeah, anything else from anybody? I think Dr. Judy, Dr. Yazir, Dr. Jasviza, Dr. Noor Hana, anything?
I don't have any issue, Prof. Everything okay.
Okay.
Hopefully, inshallah.
Prof. Mahendran, I'm assigning the chairperson for the invited session. So I later once assign, I will send back the list to you so that you know who will be the chairperson for the invited list.
Yeah, can. So that we can prepare one more, the program schedule itself, we can mention it so that will be circulated to the MC also, so that they come to know exactly who will be the chairperson.
Yes. So I'm actually putting in now. And then with the invited, even with the oral sessions, I'll put in the name of the judge, not the judges, the name of the chairperson.
Okay, that is fine.
Then I'll email it back to you.
Yeah. Later we can elaborate with the judge's name also. Judge's name I think not required in the program schedule. Only the chairperson.
Actually, judge's name also not really need to tell also lah. Actually,
not necessary.
Like usually people don't tell in conference, right?
Yeah.
Name. It's only not really needed, honestly. Yeah.
That is okay.
Yeah. Just my opinion.
Yeah. That is correct only, because judges not necessary to mention in the program schedule. Only in during the session maybe we can.
There's one more thing I want to ask.
Yes, Dr. Mohana.
If we want to be present on campus on the day that we are going to judge or going to be the chairperson, we give our name to Dr. Judy, right?
Yeah, Dr. Judy will pass to us. Then maybe we can send directly to PMTC or maybe our person in charge to give permission.
Yes, Mr. Bob also for security purposes.
Yeah. Maybe the scientific committee is the main, I think most of them. So maybe you can pass the name to Dr. Judy. So Dr. Judy will send the name to me, then I will pass directly to the person in charge to give permission.
I'm suggesting for all the chairperson to be present for the session so that can sit next to the IT person.
Yeah, something like that. Yes, you are right.
I agree.
So
I'll put in the name first, then I'll share with the scientific committee so that they know what sessions they are in, and then I'll get the name and then I'll pass to you.
Yeah. So it is up to them. They want to present the whole day or maybe during only their session. If they come 30 minutes or 1 hour before, I think once they completed their session, they can.
Do you want to get the permission for the whole lot day, or you want to get for just selected time?
No. The whole day we will get permission. But it is up to the chairperson whether they would like to stay back or they want to go after their session. It's up to them. I think we'll be okay. They give permission because this, I think definitely we need all the people. Otherwise, if any kind of issue is very difficult to contact through WhatsApp or phone call sometimes. The person is available directly so that we can tell directly the any kind of advice or something like that to complete the session a little bit earlier or something.
Okay, I think I'll get the name from the scientific because most of all the judges, all the chairpersons are from the scientific committee anyway.
Yeah.
So I'll get their name.
But probably if someone is requesting, they want to stay back at their home and their internet is stable, they can able to manage it. Just allow them, no problem.
Sure, no problem. All right. Thank you.
Dr. Judy, just one last thing, Dr. Judy.
Yes.
I'm not sure whether it is too late or what. All the judges are from Unicale only, who are selected.
Yes.
Yeah. I was thinking that it would have been better if one or two judges from outside UNICAL means it would have been better, so that we can say that judges are from outside and some are from internal judges like that. I don't know whether it is feasible or not.
Now I think it is very difficult for the scientific committee to identify also. Initially, actually, we had a plan to appoint some of the invited speakers to be the judges. But when we asked them also, they also not quite satisfied with this one, because they need to be available on the their presentation and also in the e-video presentation also. So that is the reason we haven't appointed anyone. They said they find kind of difficulties.
Okay.
I think this time will be okay. Maybe next time we can plan something better. Huh?
Yeah. Okay.
Because
okay,
now we have only 4 or 5 days time only. So I think scientific committee also very difficult. Now they put everything. They allocated everything to the judges. So now,
okay, then.
Yeah. Is that okay, Dr. Judy?
Yes, of course.
Yeah. I think will be okay. Normally, the judges, they will do marking appropriately. They don't look at the UNICAL name and everything. So just look at the poster and the content. So accordingly, they give the marks. I think no issue.
Okay.
Okay. Thank you.
Okay, sir.
Yeah, I think that's all. So maybe we can have one more trial run by Wednesday.
Yes, correct.
Yeah. So whomever is free can feel free to attend that time, so that we can discuss and we can. I think that time we will get some kind of clear picture. I think how we are going to run our real session. Okay.
Okay, sir. Then. Okay.
Yeah.
Okay, right, Dr. Mahidan.
Yeah. Thank you. Thank you very much to everyone.
Thank you very much.
See you all on Wednesday.
Okay. Thank you, everyone.
Thank you.
Okay, thank you.
You.